I don't know if that's how that went down.
That's right. No, so yeah, the Ninja Nerd, I put up his diabetes lecture, and it's way more about diabetes than you'll need for a half hour's worth of topic. But if you actually like watch it, then you got more diabetes than you need. Yeah, you live diabetes, you're fine. How's it going, sir? All right, let's get started. I think everybody's here that's going to be here for now. All right, so we're going to talk allergy and anaphylaxis tonight. And then we're going to do maybe. No? Are we not going to? Okay. All right, so we've talked about allergies before, right? Allergies is a basic immune response, okay, to some sort of allergen or whatever you want to call it, foreign substance, okay? Gets inside the body and the body says, I don't like it. We're going to kick it out. And then you get all of your histamine responses that come from that, right? So the basic definition is an exaggerated immune response to a substance, okay? Does not have to be from outside, it can come from inside, it can come from something you touched, whatever. All right, something you ingested. Okay, usually those are the most common, either something you touched or you're ingested. All right. Releases histamines and leukotrienes. All right, you don't really need to know about those. We're not here for biochemistry. All right. Unfortunately, not everyone knows what they're allergic to or if they were allergic to something previously. All right, so this may be the first time that they had shrimp and that they're now allergic to it, because we know that the severity of the reaction gets worse the more times we're exposed to that allergen. All right, so the first one might be very mild. They may not even know they're having an allergic reaction. They may not even call you. All right, you may end up for the second, third one. Okay, so we're always going to keep that high index of suspicion. All right, we're going to look for the proper signs and symptoms. And what are the signs and symptoms of an allergic reaction? Anybody?
Wheezing?
Wheezing. Yep, that's a late sign. What else? What kind of exterior signs are you looking for? Hives. Right. What's the fancy name for hives? It was on your quiz.
Oh, is it urticaria?
Urticaria. Yeah, that fun one that no one can say right. Yeah. All right. So this is basically the cellular level, all right, of what anaphylaxis is. So the antigens come in, they bind with the cell. All right. The cell starts releasing chemical mediators, histamines, all that other stuff. And basically, you'll either end up having bronchospasms and vasoconstriction, which will cause your wheezing. Okay. You may either become bradycardic or tachycardic, right? You may either have decreased output or increased output, depending on what gets released. All right, your blood vessels are either going to vasodilate or they're going to start like weeping. Okay, so your blood pressure is going to go down. All right, and then you're going to get that pruritus, which is what? Nope, urticaria is hives. What's pruritus? Yeah, boing, bang, you know, whatever. All right, it just means that the cell's releasing stuff. All right, over here, I think it's called a bomb, right? The cell sends out histamine bombs, basically. All right. So hives can come in many shapes, sizes. All right, they can be big splotches. They can be tiny, lots of little bumps. All right, so look for the hives. They may not be on the arms, all right? They may be on the trunk or the back. Could be on the neck, could be on the legs. All right, so if they feel like they're having a scratchy, itchy throat, some trouble breathing, okay, start looking for hives. The other thing is the angioedema. All right, when the tongue starts swelling out of the mouth. Okay, that's, what are we gonna do with that? Push it back in? Yeah. How do we control that airway? Nasal, yep, good. Okay, or the wheezing, right? That high witch or that high pitched expiratory breaths, right? Depending on how bad the reaction is, you may hear stridor and wheezing. Okay, again, they might be hypotensive. They could be nausea, vomiting, definitely cramping, all right, especially if they're dry heaving or retching. Okay. So food can be anywhere from 0 to 30 minutes, depending on the severity of the reaction. All right. Medications, depending on what types they are and the coatings, all right, how long they take to digest can be as, shorter and or longer. A lot of people have antibiotic, penicillin, a lot of psyllin resistances these days. I don't even know what they're using anymore for antibiotics now, other than doxy. Okay, so medication, like this is a reaction to someone's medication. Okay, so I guess they injected it in the abdomen and ended up having a problem. Okay, so you may get just localized injection site swelling and or red splotchiness. You may get a whole systemic body response. Again, it all comes down to their level of tolerance. Okay, and then oral medications, like we said, they got to be digested, but they can again be just as severe once all of that medication's in there. Plants, dust, ragweed, pollen. Okay, unless they just went outside and rolled around in some ragweed, we don't really care. Okay, when you ask them what are they allergic to, we want pretty much medications. You can say food because some food or some medications are mixed with like food bases for some reason. But for the most part, plant kind of stuff, we're not really worried about. Chemicals, they're everywhere. My ex-wife, literally, we had to go get one of those allergy tests done where they poke your back with like 100 different things, and they give you the list, and it's like a book of what you're actually allergic to. And then when you look at that, and then you go to find products that don't have like the, and it's, she was allergic to like some kind of floral scents. She'd always break out when she would put perfume on, like right on her neck, like right around here. And whatever chemical it was, I forget. It was like everything. Like it was in soap, it was in hand sanitizer, it was in like the water, like whatever, almost everything. Like she ended up being allergic to. So you got to be careful. Latex is a big one. We don't use latex tape anymore, but some people still want the cloth tape. Sometimes they're allergic to the glue that's on the tape, so they want that cloth. They're usually pretty good and they'll let you know. And then latex, make sure you only have those nitrile gloves, and that a box of the latex ones don't magically show up somewhere. Okay, insect bites, we have envenomation. All right, that's when you get injected with venom from something, whether it be a bee, scorpion, a snake, whatever you want to call it. All right. Again, depending on what you get stung by and how many times you've been stung, the reaction is going to be different. All right, what was that Stand By Me where he got stung by like 100 and like a whole bee's nest? Was that the movie? Macaulay Culkin as a kid. I know there's 4 of us in the room who might know what this movie is, but it wasn't Stand By Me.
It's
My
cool.
Girl. Yeah, My Girl. So he's allergic to bees, and this girl gets him to finally come out of his house because he's allergic to like everything. And I forget what he goes and does, but he gets stung by like 100 bees in a hive, and he ends up dying.
She loses
Kinda
her
sad.
ring and he goes to get it.
Oh, that's right, the ring. He loses a ring
Mhm.
under the beehive in the woods.
Yeah. It's
And
on
he goes to
Netflix
find
now
it.
if you want to see it.
Is it on Netflix? I haven't seen
Yeah.
that movie since it came out.
Yeah, it's on Netflix now, both of
Okay.
them.
Both of them. There's 2?
Yeah, there's 1 and 2.
Yeah. See, I didn't even know there was a sequel.
Yep.
He comes back as a ghost? Are you serious?
Well, no, it's not him. It's another kid.
I was like,
It's the same girl, but another boy.
no. Patrick was like, yeah, he comes back as a ghost. And I was like, now I might watch this. I was like, because that sounds cool.
No.
Right? So, all right. So bee stings, wasps, these are our most common allergic reactions, especially in the summertime. Okay, so we got to watch out for these. Again, we talked, you're going to gently pull the stinger out the best way you possibly can. All right, we're gonna, yeah, scrape it with a credit card so that you break it off and leave more venom inside. Apparently, there are approximately 62 deaths per year according to bee stings. All right, let's try this again. I cannot wait until you're all back because this is getting old. At work, it only happens at work. It doesn't happen. I have a cooling dock that has like 8 fans in it that blows from underneath. It doesn't happen when at home when it's on the dock. Otherwise, it happens all the other time. It is. It's just a pain in the ass to put in there with everything else. Huh? Clearly this. So you're probably right. I should probably bring it. What's the worst that could happen? You're right. It goes out again. So yeah, she leaves the room and it would turn itself off. It's her. It's all her fault. You're not allowed. All right. Can everybody hear me? Is everything back working again?
Sounds like it.
Going for round 2. All right. So we talked about the stinger, right? It's a small hollow projectile. Okay. It still has venom inside. All right. Which is why we're trying to take it out so no more of the venom gets leaked through. All right. Here's the little culprits. Okay. Honeybees cannot withdraw their stinger. The honeybee gets you. They get you once. That's it. All right. Wasp and hornets can sting you multiple times. So just look out for multiple injection sites, depending on what it is. Okay. And be careful. The honeybee has a barb on it. So just be careful taking it out. Think of it like a fish hook. If you ever got a fish hook stuck in you, there's a barb. All right. So you may cause a little bit more damage coming out. All right. Fire ants. Apparently they're farther down south. We don't really have too many of those up here, but just be careful. All right. They strike often and the hell's the word I want to say? They swarm, huh? They ate the toe right off? The toenail? All right. What, on this one? This one? It's swollen right here. The toenail's right here. This is all swollen up, but there's a little bit of toenail right there. It does look like they ate the whole toenail right off. You're right. But it's there. All right. So again, insect stings, there should be pain involved where they got stung. There should be localized swelling. It may be some heat, some redness. You may have one big lump like the picture, or many small hives or urticaria. Okay. Possibly a wheal like you see up there, which is a large white elevation in the skin. Okay. Again, most people know what they got stung by. You'll see. Again, insects are pretty much the same, right? You'll have that stridor, wheezing, chest tightness, coughing, difficulty breathing. Depending on the level of reaction, they may be anxious. All right. Again, the GI problems, nausea, vomiting, abdominal cramps, hypotension, they all kind of end up being the same. Okay. They may go into respiratory failure again, depending on the airway, how severe it is. So we're going to do our best to aggressively manage the airway. right? And any type of anaphylactic reaction obviously can lead to death. Okay. And apparently within the first 30 minutes. All right, so it's not something we just stick around and kind of wait for. All right, so we're gonna use that EpiPen, right? And how long are we gonna hold it for? Huh? At least, yeah, at least 3 seconds. We'll just go with at least 3. All right. Somewhere it says 10, but it's at least 3, between 3 and 10. If you see it on a test, they would pick the 3-second answer. All right. So what are we gonna do? What's our scene size up? Yeah. So if we got a lot of things stinging people around, is the scene safe? Yeah, but what are we gonna do about it? Wait, you're gonna wait for all the stinging things to go away? Yeah. What if they don't go away? Ask the patient to come. What if they bring them to you? What if they're following them for a reason? What if they have a specific smell on them that drew all of those insects to them? Call me back when swat them away, swat them, right? Yeah. So, all right. I mean, we're joking about it, but you got to decide. Like, you're gonna go in and get stung a couple times. You're gonna, you got to go in. You can't not. It's allergic reaction. So you do what you got to do. All right. Hold on. I got to take this real quick.
You can't see this, but he's taking a call right now. Please stand by. Someone will be with you shortly. I really like that this portion of the class is being recorded.
apparently everything blew up this weekend. Somehow I got dragged into half of it. Well, one of our employees apparently tried to report some sort of sexual harassment, and whatchamacallit, HR wasn't getting back to her soon enough. So she got me involved on Sunday, and then I was like, or last Sunday. Yeah, it was last week. She got me involved last week. And I was like, talk to them about it, figure it out, and come back. And apparently she brought my name up and did some of the conversation. So like they want to talk to me about it today. And I was like, all right, no problem. And then we got this other kid who's talking crap about everybody else who should not be talking crap about it because he can't do his own thing. So whole bunch of admin side stuff that I shouldn't have to deal with, but or tried to get done before class, but yes. I mean, no. It will, because I didn't know what date it was because I didn't have this right next to me. It will happen on March 5th.
Called
March
it.
5th will be your practical with the sheets. I said February so you could be prepared in case it was February because I wasn't sure.
Bullshit.
I wasn't sure. I didn't know. I don't have the schedule memorized. The only thing I mean, you shouldn't really need to prepare. You guys are gonna have like 10 labs before that of literally just going through everything. When everyone gets back from January 29th through March 5th is nothing but labs. There's no more lectures. We'll be almost done by then. Yes. So it will literally be almost lab like every day from there out. Actually, all of February, if you look at your schedule, is labs. You have 1, 2, 3, 4, 5. You have 5 labs before your practical. And then honestly, you're going to have way more than that because we're going to be almost through geriatrics by the time everyone gets back. So you'll have 1, 2, 3, 4. You'll have almost 10 labs before your practical. If you aren't like labbed out and ready to go by then, I don't know. I can't help you. All right. You guys will definitely be ready. Okay. All right. So getting back to this though. So scene safety, right? So what are we going to look for depending on what the allergen is? What do we want to go with? Do we want to go with an insect bite, food, or medication? Let's make up our own scenario. I'm not going to make one. Huh? The extra snake?
Insect bite.
All right. So what are we looking for then? Where are we going to be? All right. If we're going to go with a snake bite, because that's the first thing I heard. We're going to be in someone's bedroom with a snake bite. All right. So it's their pet anaconda got out from the tank and was under the pillow when they put their head down and snapped up around and got them in the face. All right. I like where this is going. We're doing good. They make movies about these things. Okay. Could have been on a plane, but you didn't go there. So now we're in someone's bedroom with a snake bite. All right. Now the snake is loose somewhere in this bedroom. Has it been located? I don't know. Has it been located? You guys are in charge, not me.
I'm gonna be looking for that snake as soon as I'm at the doorway.
How critical is the patient? Okay. Oh, yeah. So the pet cobra, we're in India and the pet cobra just got out from its little basket and put itself under some dude's pillow. And now we're okay. Now they got bit in the face by a king cobra. So I'm going to say this whole side of his face is probably like a balloon.
I'm not going in until I see that snake.
I'm with Carolina on that one.
So everyone in Zoom's not going anywhere near it till the snake's found.
Yeah, nope.
So he's dead because his airway is going to shut down and
My safety first.
I mean, that's right. My safety first. You're absolutely right. I'm doing the same thing. So I am gonna grab the little flute by the bed and give it to you, and you're gonna start playing the flute. And I'm gonna go after the snake, or not the snake. I'm gonna go after the patient while you mesmerize the snake. And then after that, when it bites you, I'll come back for you later. Okay. All right. So let's go. All right. I think we talked about this, right? Be mindful of whatever else is in the room. Be mindful of respiratory distress. Obviously, if you were bit in the face by a pit viper, you're going to be in a whole world of hurt, right? There's probably going to be some traumatic injury involving that too. Okay. Minimum gloves, eye protection. Yeah, I probably want like steel plate, at least up to my knees, right? Animal control better be there. Don't worry so much about me. I'm just gonna stand outside and wait for you to bring them out. I'm not going in that house. I'll be in the ambulance getting stuff ready. Additional resources. This one I would definitely call animal control.
I actually have a related story to this.
Okay.
We were at a wires down call at 2 a.m. and Central Hudson is there. I think it was. It was on this side of the river back when I was in Hillside, and he's doing something up on the pole, and he starts yelling, and he comes down. He brought bees with him, and they came back, and they got inside his truck. Yes, he was up. He disturbed some beehive. He brought him all the way down, and they went in his truck, and they were attracted to his yellow light bar on the top, and they were inside his vehicle swarming around. So I put my bunker gear on, got all the way masked up and everything, and I just started smashing the things with the glove up on the ceiling of the car. So I still got stung. I got stung like twice maybe, because some of them found a way, but it was an interesting experience dealing with that at 2 a.m. on a wires down call. You don't expect that.
No, and I don't know if fire gloves are FANG rated.
They seem to do okay, but I don't know.
Well, I mean, for stingers, yes. I'm talking about, like, let's go back to our snake thing. Like,
yeah, I don't know what
going
the
in with
thing on that is.
Yeah, I don't know what the puncture rating is for the fire gloves, but so again, additional resources in this one, I would probably go with animal control, especially if it's a snake or something venomous, right? Let them deal with that. Try to get the guy out if you can. Try to get them to walk out, like some people said. Okay, do the best you can. ABCs, right? Okay. So, did I go too far? Nope. All right. So now what are we going to do? All right. Again, there's not much we can do. Okay. You guys are going to do your thing. Give them the epi, especially if it's severe or anaphylaxis, and we're going to transport to the hospital. Again, if we get there before you leave, right, I can do Benadryl, steroids, breathing treatments. All right. So kind of wait, but don't wait. You know what I mean? Like, if you can time and plan everything out so that your ALS arrives when you're ready to go, and then you can just go, that's a good thing, but don't wait around. All right. Again, this says scrape the skin with the edge of a sharp, not use tweezers. I would much rather use tweezers. I think all you're going to do is break the stinger this way, especially if there's a barb in it. You're not going to get the barb out with a credit card. So you guys decide what you want to do. I mean, like I said, there's tweezers in the OB kits if you want to open that up, but people might get mad because they're expensive. Okay, wash the area if you have the ability to. Let them use alcohol wipes if you can. If there's no soap and water, take the jewelry off. Obviously, if it's like some kind of venomous bite, right, you want it below the heart to slow down the spread. Okay, ice or cold packs does the same thing. All right, again, airway is the major concern with these. Okay, we're looking for that swelling. We want to control the airways. So if you have to put an airway in and start either giving oxygen or a bag valve mask, right, do what you got to do. Okay. Supine again is, give the heart the least amount of rest, or the most amount of rest. Okay, and oxygen. And always vitals, treat for shock. How do we treat for shock? Blanket oxygen and what? Rapid transport, right? So. Huh? Are you gonna C-spine someone who got a bee sting? Yeah, it's blanket oxygen transport. I mean, consider C-spine if it's traumatic shock or hype, you know what I mean? If there was an injury involved, if it was shock due to a trauma, but we always consider C-spine, doesn't mean we have to do C-spine, right? All right. So again, we have the EpiPens, okay, or the check and inject, whatever you guys are using. All right, so it mimics the fight or flight response, more the fight part of it, right? Causes the blood vessels to constrict, bring your blood pressure up. Okay, reverses the vasodilation to hypotension, increases the cardiac contractility, which means it makes your heart work stronger or works more, right? It beats more often, okay? And will it reverse all the effects of anaphylaxis because it will dilate your bronchospasms because they're smooth muscle. Okay, so that's why Epi works so well in anaphylaxis. All right. So we know about the EpiPen. Okay, depending on where you work in your regional protocol, you may or may not be allowed to use EpiPens. They may have their own. All right, just make sure you're doing what you're supposed to be doing. In New York, we all know that we can do it. We can also do the check and inject if that's what your agency is using instead of the pens, because the pens were ridiculously expensive for a while. So Melanie, I let in. Yep. She tried to get in, I think, as I was leaving. So. All right.
I'm here.
Melanie's here. All right. So we all know the doses of EpiPens, right? Adults is 0.3. Infant or child is 0.15. Okay. We've gone over it. You do not have to roll the pants up like this one. They're doing it just for the video purposes, but the needle is engineered to go through gene material. All right. So you're going to get it ready. Jab it in, hold it for up to 3 seconds at least. All right, you should make sure all of it is injected. Okay, and then you're gonna let it go. And then we're gonna secure it. Okay, because it is a sharp. Okay, so side effects. These are things that we're gonna reassess and reassess often for, right? Blood pressure is gonna go up. How high does it go up? Increased pulse rate. Okay, you're gonna do your vitals right before, so that we can trend these things. All right. Again, anxiety might kick in because they were feeling like crap, and now they feel like they just got a shot of adrenaline, which is basically what they did, right? We just jump started everything. You may or may not, you definitely won't see, but you may be able to feel a cardiac arrhythmia, right? Because you guys don't have monitors. They may be in there. The color may change. They may get dizzy. Again, because we're rapidly changing the physiology of what's going on in the body. They may get chest pain because that heart's going to start working harder. Probably a headache, again, because the blood pressure is going to go up a little bit. All right. And some nausea and vomiting because, again, it's a whole reversal of whatever the body was doing 2 minutes ago.
Pallor is, what is it? Turning white, right? When they get flushed from something like this?
Well, pallor is just the skin color is going to change, right? Pallor.
It's not getting pale.
I always took pallor as meaning skin color, but now we're going to look.
I could be wrong.
Pallor, an unhealthy pale appearance. Yeah. I mean, they might. Okay. So I'll take pallor out of here.
I have a question.
Yep.
So if we have someone who's having a severe allergic reaction and we know they need an EpiPen, we actually have to take vitals first before injecting, like even if we see that they are in a really they're having a really bad day?
Yeah, you should, only because you want to know vitals before and after every medication. So it's kind of something. How's that, Joe? Better? How'd I do what? How'd I change it? I'm good like that. That's why I'm the IT guy. No, so you always want to know where you started versus where you end up when it comes to any type of medication. Okay, so it's something you're both going to do at the same time. Like your partner should be getting a set of vitals, and then you're going to be prepping either the syringes or getting the EpiPen out, or helping them with their EpiPen, or finding it. Right, if they're like, it's in the kitchen in one of the drawers, and you got to go hunt for it. Okay, so depends on timing, but yes, you should be doing a set of vitals before and after any medication, especially Epi and Nitro. Aspirin, not so much. O2, you should get a room air O2 before you put it on. Don't just walk in and throw it on somebody. Hospital staff is always going to ask you what the room O2 saturation was. All right, so you should always have that before you put air on. And then most of the times when you get there, they always take the air off for about 5 minutes to see if it'll drop. And then they get their own room air, and then they will continue to treat with oxygen if necessary. So, but vitals are important. All right, they let us know if what we're doing is appropriate. Okay, so again, if this is not severe anaphylaxis, we're not going to give epi. All right, otherwise we're going to cause more problems than we're going to solve. Okay, so if they're not in any respiratory compromise, then don't worry about the epi. Don't just walk up and be like, oh, you got stung by a bee, click. Right, like unless they're in that severe stridor, wheezing, hypotensive state. Okay, like, you know, possibly a little Benadryl is going to help them. So you just wait till I get there, right? If it's a localized reaction or something, I can give them a little bit of Benadryl. We can call it a day, right? Because even I don't jump right to the epi. Can you hear me now? Okay. It says it's recording. You can hear me. We're not screen sharing. Is that what you're saying? Okay. I mean, we're just about done. This is the last one anyway. Right. So what was I saying? Right. So, well, if they're really bad, you're right. I'm going to give them Benadryl, the steroid, and the epi, but I'm going to give them all three. Okay. It's all IM. I can do all three IM, or if they have good vasculature, it's not going to take me more than a minute to get the IV. Like I don't have to sit there and like hunt around and slap the skin and try to get a vein to pop out. Like otherwise I'll just do it all IM. Kind of sucks because I got to do 3 different shots IM, and they kind of hate me for it, but it is what it is. Huh? No, usually I'll do like a Benadryl here. I'll do the steroid on this side, and then depending, I'll go back maybe and do the epi on the Benadryl side. But that's only if it's like severe. If it's a localized, I'll just do the Benadryl, see how they react. If I don't hear any wheezing, then I usually won't give a steroid. But it, you know, I mean, it depends on the severity on the presentation. So, the hell is the one we use now? It's not prednisone. We used to have prednisone. Now we have dexamethasone. Huh? I forget what dexamethasone is. I rarely ever give it. I don't like giving steroids. It's a glucocorticoid. So it's part of the corticoid steroids, but it's a glucose version. All right. Does anyone have any questions on allergies? Because that's the end of allergy. Real down and dirty. I know, right? That's all right. We didn't lose too much. Yeah. Does it even say if I'm recording on there? Oh, so it does say on the screen. It does let you know. All right. I'm gonna make Caroline in charge next week. All right. So the pinpoint pupils is your telltale sign. All right, of this one. And yes, if they're unconscious, you flick their eyelids open and you take a look. All right. If they start fighting you, then they're obviously not as unconscious as you think they are. All right. And that's where you flick them right in the eyeball and you say, wake up and stop pretending. No, we don't do that. All right. That's just a joke, maybe. All right. Again, sedated or coma. All right. Depending on how much they overdid or how much they took. Right. And they will be hypotensive. All right. If you go the other way, cocaine, amphetamine, speed, all right, what we call sympathomimetics, they're going to be the other way. All right, they're going to be hypertensive, they're going to be tachycardic, they're going to be anxious or worst case seizures. All right, but these are going to be your uncooperatives. They're probably going to want to fight you. All right, their pupils will look like dinner plates. All right, you may not see any of the iris. They might just look like a big black window to the soul. All right. And of course, like I said, they're going to be warm. All right. They may be sweating. They may be diaphoretic. All right. So your sedatives. Okay. These are your some of these are your anti-seizures. Some of them are your antipsychotics. All right. So they could have slurred speech. All right. Again, these are all downers kind of things. So they're going to react the same as opiates and opioids. The only thing you're going to see different is the pupils. All right. So if there is no pinpoint pupils, then we're going to suspect some other type of sedative. All right. Anticholinergics. All right. These are not necessarily medications that they're going to overdose on. These are kind of exposures other than possibly the diphenhydramine, but again, these are more sympathomimetics. They're going to be the same. So you're going to be tachycardic, hyperthermic, hypertensive, dinner size, pupils. All right. The only thing these are going to do is they're going to dry you out. All right. You're going to have the dry mucous membranes. They're going to be thirsty. All right. They're going to ask you for water. Okay. They could have a gambit of altered mental status. They could be sedated, seizures, fighting, coma, delirious. All right. These are, you have no clue what's going on. All right. Doesn't make sense. Okay. And then you have your cholinergics, which are your organophosphates, nerve gas. All right. All your good stuff. Sludge them. You should remember. Okay. Salivation, sweating, lacrimation or tearing, crying, urination, defecation, nausea, vomiting, some kind of GI upset, emesis, and or muscle twitching / meiosis or pinpoint pupils, depending on what the agent was. Okay. If they cannot control their urination or if they are defecating themselves, right, that's not a normal thing we do. Okay. So we do have organophosphate stuff in the trucks if there is some sort of exposure. All right. So we can actually do things, but just remember that mnemonic. You'll see it again somewhere. No. All right. If they're conscious, ask them what they took. Okay. Ask them when they took it. Ask them how much they took. All right. Ask them if they ate or drank. Why do we care if they ate or drank? Huh? Not dilute it, but it's going to do, you're close. it's an absorption thing, right? But it's gonna make absorption take what? Take longer because there's more food in the stomach. There's more things in there, right, for it to digest. So it's not going to be directly against the lining, right? There's other stuff getting in the way. Okay. Did anybody give you anything for it? All right. They used to do syrup of ipecac. We used to make people vomit on purpose. All right. We used to do activated charcoal, which make people vomit on purpose. We don't do any of that stuff anymore. All right. There are certain antidotes, right? Did anybody give you Narcan? How much? All right. Usually you can tell by the 4 empty Narcan bottles on the floor next to the patient that the cops gave before you got there. Because they want to wake them up to ask them all these questions, right? How much do you weigh? We don't really worry too much about that one. All right. We used to have weight-based medications, but like I said, we don't give those anymore. All right. So you can still ask them that, but it's not the important stuff. All right. Again, try to figure out what it is. Okay. Look around. Do not transport drugs to the hospital. All right. If it's some sort of chemical or nerve agent, you can take the bottle with you. Poison control, you can always call poison control. All right, depending. We had one in Columbia County at the new like research facility they have over there on Hover Avenue in Germantown. They do a whole bunch of different, they grow mice, they inject mice with things, then they dissect them and make slides out of them and study whatever they're studying. But the one lady was feeling weak and nauseous and lightheaded. And I came in and there's all these steel drums of various things. And I'm like, all right, well, everybody get out. Like, do I need to call the fire department? Do I need to have it tested? Like, what's in the containers? Like, are they leaking? How would we know if they're leaking? Right? Like, these are all questions I started asking. The lady's like, no, we're fine. We're fine. Like, there's alarms. If something was leaking, they would all go off and auto shut off and all that. And I'm like, okay. It's like, I just want to make sure everybody else is safe before like 14 scientists are sick, right? So just pay attention to where you're at. Okay. They were all apparently liquid nitrogen for cooling. So, and they swore they weren't leaking. But, all right. Again, I'm not going to go searching for pill fragments, but just kind of take a gander as they're throwing up what's coming out, if you can kind of stomach it. Otherwise, document anything you see. Sometimes it'll splatter on the floor and you'll see whole pills come out, especially if they took a lot and they're not digested yet. So just keep an eye on anything that you see or anything. Like sometimes they may vomit in the sink before you get there. So have someone go check the sink. A lot of Nope, because depending on what it is, they're either going to pump their stomach or they're just going to let it run its natural course anyway, which is your body's going to want to throw it up. So let them throw up, give them emesis bags, grab a bucket from the closet if they're throwing up that much. Sometimes it's projectile vomiting. Why does this keep doing this? Is the screen still sharing or no? No? Okay. Screen share. It is recording. Everybody can hear me still? All right. So what we do depends on how it gets into the body, right? Know the 4 routes. They're going to ask you about these. All right. You have inhalation, absorption, ingestion, and injection. All right. All of them can be life-threatening depending on the substance. Okay. So here we have our lovely kindergartner who's 30, still sniffing glue. All right, let's not pretend we all sniffed the rubber cement when we were in school. That's why we're probably not even allowed to have it in school anymore. It's because we all huffed the hell out of it. All right, they were beautiful. They were nice bottles like that had a little brush that stuck inside. And as you took it out in art, you went, Right. Okay, we all did it. That was our first attempt at getting high. We were all 5 or 6 years old. You never snuffed this rubber cement? You were a marker sniffer, weren't you? That's why they make cherry and strawberry markers now, is because you were a marker sniffer. Huh? They were yeah, people started eating the markers. Huh?
Guess I'm the weird one. I never did that.
You never huffed the rubber cement either? Come on.
No,
Well, apparently I'm all by myself.
I waited till my late teens to experiment.
I'm with you.
Says the guy who plugged a hole with a pencil. That makes sense. All right, so the guy powder some kind of substance on his hand, right? That's going to be absorption, right? A is inhalation. Okay. C is obviously ingestion. The guy's going to take some pills, right? And D is clearly injection. The guy has a needle. All right, right into his vein.
Is there a story about plugging a hole with a pencil that we didn't get to hear yet?
Yeah, there's a story about plugging a hole with a pencil. Well, that's usually what they do because they don't have access to medical grade tourniquets. Anything. What? Nothing. Somebody was at work, had a problem, fixed it with a pencil. That's it. I don't know. We're not going to go into that right now. We got to catch up. Then we can tell stories. All right. I know. I'm horrible. Okay. So inhalation, obviously, if they're still in the area, right, we're going to take them out into the fresh air, remove them from the area. Okay. Again, it's going to depend on the type of gas, the inhalation, and where it is, whether you go in to get them or the fire department goes in to get them. All right. And they come out. If it is a considered hot zone and you go in, you better stay in. Don't come back out of it. All right. You've now become part of the problem. Do the best you can while you're in there. And then when you fall out, we'll come get you later. All right. So just be aware of what's going on. Okay. Again, depending on what it is, we're going to have to decon. All right. So as part of your additional resources, call the fire department, let them know what's going on. Have them call the hazmat teams. We'll talk more about hazmat at the very end of class. Okay. Again, we're worried more about airway, possible airway burns, airway swelling, right? So this is another aggressive airway management. All right. So they may need suction. They may need supplemental oxygen. They might need an airway. I had a guy do this. It was very elaborate. I think he was murdered, not suicide, but so again, Columbia County is great. Let me just tell you this. I've seen some of great things in Columbia County. I like the story I'm about to tell you. Based on I think this guy was murdered by his farmhand and not actually committed suicide, because there's no way this happens. So we get out there, we get called, and the guy comes up. He's like, yeah, he's out in the field. I think he's dead. Like, okay, cool. So we're all walking, and there's a whole bunch of Highland cows, like the real big ones, real hairy. The hair runs down to the floor, right? They're like orange. I don't know. They're mean looking. They got horns that are like 8 feet long. And I'm like, yeah, I don't really want to be out here. I don't feel like, can we get these somewhere else? They're like, no. I'm like, all right. So we're walking. All of a sudden you see a pickup truck in like the woods halfway out the field. I'm like, I don't even know how he got the pickup truck there. There's no path, but it's there. I'm like, all right, cool. So next to the pickup truck, you see a 4-wheeler. And on the back of the 4-wheeler, there are 3 spare gas tanks daisy chained together into the actual gas tank of the 4-wheeler. And then there is a hose coming off the tailpipe of the 4-wheeler that leads into the driver's side window that is duct taped off and sealed, right? And then the window is duct taped off from the outside. Okay, so right, this is why I think murder. Okay, all of the rubber seals on all of the windows are duct taped off on this guy's truck. And he is sitting in there with a bag over his head. And the ATV was still running. But like it was on its last bottle, like the last tank of gas. And I was like, yeah, no, we're good. Like there's not, he was blue. His tongue was like out. Like he was gone for a while. He'd been there a couple days, day or two. And I'm like, this is way too elaborate to like be suicide. But he was like, yeah, his brother died like 2 weeks ago. He's been really depressed lately. And I'm like, suicide is usually like a passion thing. Like it's not, like this was well thought out, planned. You didn't just drive one thing out here. You had to drive two things out here, daisy chain all this, tape all of it up, like put a bag over your head, get in the truck, and then somehow seal yourself in with duct tape. I'm like, So I don't know. I thought he was murdered, but this was like 2-3 years ago. Some random farm. But yeah, I put the leads on him. He was asystole. He was cold. It was like the middle of winter. I was like, can we go back now? Like, there's no reason for all of us to be standing out in this field. Like, it's cold. And there's angry cows staring at us. I'm like, I do not feel like, huh? And there's possibly a murder. Yeah. This guy over here, I don't like. Yeah. That's what I said. I even told the cops, I'm like, yeah, the doors are sealed. He's like, what? I was like, the doors are sealed. I'm like, so I didn't open it. So I waited for them to open it. He's like, yeah, how do you do this from the inside? I'm like, exactly. Yeah, right. How do you do this from the inside? Right. I'm like, why are you asking me these questions? These are clearly cop questions. But yeah, no, I never did find out what happened to him. So vehicles can be used to commit murder and make it look like suicide. So again, be careful. People do it in the garage. They light the car, right? So open the garage up, have it, let it air out before you go in there. All right, you don't want to get carbon monoxide poisoning. Okay, so absorbed poisons. All right, anything mucous membrane or skin contact, right, is absorption. Okay, so your eyes, your nose, your mouth, any part of your skin, open skin. Okay, yes, even your rectum is a route of absorption. All right, you must really get someone mad at you though, because I don't know how you get something down there that you get poisoned on, but it might happen. All right, could be a splash, something. Chemical burns. All right, be aware of chemical burns, especially if you see like a splash pattern on somebody. Okay, different rashes or lesions or different stages of things healing. And there will usually be systemic effects overall. All right. So they should be able to tell you they were exposed unless they're obviously unconscious for whatever reason, or if they've been exposed for an extended period of time. Can be liquid powder, anything really. Like I said, even the nitro powder from inside the vial is enough to have an adverse reaction, right? That's why we wear gloves when we give nitro. So this is another example of that. All right. Depending on the acidity of it, it could cause burning, itching, irritation, redness. All right. Again, you're gonna be able to smell the bleach. You're gonna be able to smell the ammonia, right? Smell the chemical. There's usually an added smell so that you know what's going on. All right. Again, me, myself, and I. Okay. Decon as fast as you can. Remove the clothing. Flush and wash. Right. That's how we deal with poisons. We flush, hit them with the hose. All right. If you're the hazmat team, they have nice little portable showers. They stand them in. Okay. So if it's a dry powder, again, try to brush the powder off the best you can before you flush it. You don't want to cake the powder onto the skin. All right. So we're going to brush it off. Everything is 15 to 20 minutes. Okay. Any type of exposure, you are going to wash, no matter what it is, for 15 to 20 minutes. You get something in your eye, you flush your eye for 15 to 20 minutes. You get something on your clothes, all right, take your clothes off, you wash your skin, 15 to 20 minutes, soap and water. Might as well just take a shower. All right. That's rule of thumb. Okay. If you see any type of question where they say, how long do you wash? It is 15 to 20 minutes, no matter what it is. Here is the Outside the box eye wash with a nasal cannula. All right, someone hooked the end of the nasal cannula up to a 1,000 bag. One person's over here squeezing it. The other person's flushing the eyes out. Which way do we flush? We talked about this. Inside to outside, right? That's why both nasals are pointing this way, and he can do both at the same time, right? Inside to outside. You don't want to flush the other way around. Why don't we want to flush inside to outside or outside to inside? Huh? No, not so much of pools in the eye. It can get right, like so here, when it runs out, right, it's gonna run down. If it gets a little bit in the ear, I'm not really worried about it, right? But it should go over the ear. Okay, but if it starts pulling this way, it's got a chance to run down into the corner of your mouth, right? It's gonna follow this curvature of the face. It may run down under here. All right, but there are other routes of entry. Okay, so we want to keep that safe. Know what's going on in your industrial settings. All right, like I said, be careful of containers. Know where the safety equipment is. All right, there should be someone usually running around upset because they're the safety officer and something happened on their watch. So ask them, they should know the answers. Okay. See if they have a shower. See if they have what we call the MSDS, right? Material safety data sheets for all the chemicals in the building. Every place has to have them.
They're not called that anymore.
What do they call them now?
Safety data sheets.
Okay. All right. So they got rid of the material part. You make me go in and get rid of the material word.
I'm not making you do it, but it would be most correct.
All right. So we're gonna obtain safety data sheets. All right. They should be in a book. They should be stored somewhere. There should be one for every chemical, including like the Windex that they use for the glass. All right. It's just OSHA standards. All right. We'll talk about that in the last couple chapters. All right. Ingestion, about 80% of it obviously is by mouth. Okay. You don't really ingest it or imbibe anything other than by your mouth. Yes, people do drink bleach, other household foods. They do try to certain. Oh no, there are teenagers who try to drink bleach like straight out of the bottle, and they have chemical burns down the sides of their mouth, in their mouth. All right, they definitely have airway issues that you have to deal with. Laundry detergent, yeah, Tide Pods, idiots. Right, so obviously food poisoning goes in this one. Drug overdoses, certain plants people eat for medicinal reasons. Okay, they might have a reaction to. I would say accidental in children under teenage years. Sometimes it is definitely purposeful or deliberate in teenagers and adults. All right, it's a conscious decision that you're making at that point. All right, and again, you will notice burns around the mouth, the tongue. All right, the nausea, vomiting. Depending on what it is, they may be seizing. All right, so suction if they're foaming, obviously from the mouth or something like that. Cardiac dysrhythmias, you're really not going to be able to notice, but just know it's a thing. Okay. If you need to, call Poison Center. All right, and med control. Let them know that they did something, but you don't know. All right, more often than not, they're going to tell you just to bring them in and bring them in quick. Okay. And then obviously just be careful. Okay. Because you don't want any of what they're throwing up on yourself either. All right, because that's again contact for you. Okay, so face guard, glasses, gown if you want to. All right, whatever you want to do to keep yourself safe. All right, some places, again, I know because you guys are from different areas, so I put this in here. New York, we do not use charcoal at all anymore, but some places allow you to still do activated charcoal. All right, again, they have to be alert oriented, able to swallow. If you can get them to swallow more than once, you're doing great. because usually by the time it gets in their mouth, they spit it right back out because it's gross. All right, but they are supposed to be able to swallow it. And then it will induce vomiting. Okay, so have an emesis bag ready. Be prepared to suction if you need to. Okay. Again, try not to do this if there's any type of airway compromise. All right, because you're literally asking for aspiration at that point. All right, so this one, I know we were doing good, weren't we? Yeah, I'm getting there. It's like a process. There's like a couple buttons, y'all hit them, and I hit them in a certain order. Yep. All right. So we've beaten the envenomation to a dead horse. We're not going to talk about that anymore. All right, we're going to focus mostly on IV drug use. Okay, again, because it's IV, this is the fastest route, all right, of poisoning. This is the one we have to be the most worried about, right? Because we cannot do anything for it. We can't dilute it. We can't take it away from the body. And there are few antidotes that we actually have available to us, right? So you may see weakness, dizziness, fever, chills, unresponsive, again, agitated delirium. They may be aggressive, combative, depending on what they took. They may stop breathing. Maybe, what else did I say? Hypoventilated, may have gurgling respirations, snoring respirations, right? Might have to open up the airway. All right, so again, we're gonna aggressively treat these airways, all right? Possibly Narcan if we can. Oxygen, all right? They may start vomiting, so we're just gonna be careful. All right, and again, you wanna take jewelry off, just in case they have an adverse reaction, they start swelling. All right, you don't want jewelry cutting off circulation to appendages. All right, so what are we doing? Right, we're gonna make sure we're all safe. Usually, hopefully we have PD, possibly fire, possibly hazmat, right? Whatever we need. Animal control, whatever you want to call it. If they're unconscious and there's something in the mouth, again, we're going to clear the airway, take those tablets out. All right, but we're not sticking our fingers all the way in, right? We're going to wash or brush the patient's skin. Okay, ABCs are the most important here. All right, this is what we really need to worry about. So aggressively manage the airway, provide oxygen, BVM if we have to, suction. Okay, treat for shock. All right, again, if you're allowed to do the charcoal, give the charcoal. All right, it'll either be vomited or passed in the stool. Most people usually vomit. When we were allowed to give it, the few times I actually gave it to somebody, they threw up. Again, we do not use charcoal in these instances. All right. I don't even know many places that use charcoal anymore, so I really wouldn't worry about it. I'm not going to ask you any questions about charcoal on a test. All right. I don't think the state does either. Okay. This is why we asked their weight, was for charcoal. Okay. It was 1 gram per kilogram up to 50. Okay. So again, if you weighed more than 100 pounds, you're just getting the whole bottle anyway, but good luck getting them to eat the whole bottle. So again, it used to be a med control option only. All right, follow the directions on the bottle. Record the time that you give it so that you can tell the hospital. Okay. And then obviously, anytime anybody refuses any type of intervention, document it. All right, that way you protect yourself. Okay. And obviously, black stools. So people may be afraid that they're having like a GI bleed when they take this stuff. Just tell them it's normal. All right, the charcoal's got to come out somehow. All right. It's probably the last we'll ever talk about charcoal. Okay, so we're going to talk about tolerances. A lot of times, and this happens in the pain management community a lot, especially with oxycodone and other ones. The longer you take it, the more tolerant you become, which means you need to take more in order for the pain relief that you're looking for. However, the more that you take will actually cause a hypersensitivity to the pain that you're in. So the more pain medication that you take to feel better will actually make you feel worse. And people don't seem to get this. All right. So they're like, I'm taking my pain meds and it doesn't work. Well, how many did you take today? Oh, I took 3 because it wouldn't go away. Well, how long have you been on pain meds? Like 10 years. Well, now we know. All right. That's not going to go away. All right. So once they have that tolerance, okay, the addiction usually comes afterwards. All right. These are the people who walk in, sit down in the ambulance and go, I'm in pain. I'm like, okay, from what? They're like, I can't have morphine. I can't have fentanyl. I need the one that starts with a D. I'm like, cool. Like, well, you're going to be in pain for about 20 more minutes because I don't carry that one. And now you're not getting anything. Right. Because I refuse to give those people more pain meds. All right. They need to be slowly weaned off in a probably like a methadone type clinic. All right. Because they're causing their own problem. All right. And it sucks because my dad broke his foot when he fell off the roof and he refused to take the oxy simply so that this didn't happen. So he sat there in like a month for excruciating pain using Tylenol, but he didn't want to get hooked on the oxy and have this happen. So it's horrible that that's what we use. But, and then I don't want to speak for Mark about doctors, but it seems like doctors are very quick with pain management these days, where it's just like give them whatever they want. And I know when I worked in Maryland, we had a few people who were under investigation for prescriptions, for just writing people pain management prescriptions when they didn't need it because they asked for it. And they were just like, yeah, sure, here, whatever. So I don't know how the doctors are around here. Some seem pretty lenient with pain management. Others seem a little bit more held back, but I don't know if we're causing the problem or like the medical system is causing the problem.
Especially what I do is definitely balance, because pretty much everybody that I see has some kind of kidney broken foot or a surgery. That's why my kidney fits. So it's definitely a lot more in the last 10 or 20 years. Definitely much more prevalent to be conscious and set up plans, make sure that people are using it only for the acute pain of trauma or surgery, and not being used for more of a chronic pain. That's definitely fall by the wayside in the last 5 to 10 years.
That's good. Do you notice any like addiction problems?
Like that, when I first got about 12 years ago, since I was a new guy in town, I definitely noticed like a lot of people on my schedule that were chronic pain issues and just looking for a prescription. But just as time goes by, the word, just like any other addiction community, word gets around. So I don't see those patients anymore, and they don't come looking for it. So, but I also think that New York State can do a pretty good job of helping doctors as well. Some of the new legislations and some of the awareness programs aren't coming to us as they used to, just seeking pain medications for their addictions.
Yeah, don't they have the what the hell is it called?
Well, there's an ISTOP.
It's the list, right?
Yeah. So, anybody that's prescribed narcotic medication is registered, and so I can pull up your name and date of birth and see exactly when, where, who, how many pills, what date. So that's all information that's available to every physician or provider.
And there's like a state watch list too for abusers, like the people that shop, we'll call it shop around.
Yep.
Yeah. So they're doing better.
But those also have to be access too. So, technically speaking, anytime you prescribe a narcotic, supposed to access the iStop.
Yeah.
And that's where the list comes up, or if somebody's in a doctor shop, or, that'll come up on there too.
Cool. So they are getting better at it. Good. So maybe we won't have this problem in a couple years down the road. Hopefully, it got really bad there for a while. It was like everyone you got in the truck was asking for drugs. So again, when you're out there, please be careful, especially with overdoses. You never know if there's another person in the house. You never know how many people were there, who was there, right? You don't know, especially in an IV drug setting. All right, if they're sharing needles, contaminated objects, right? Just be careful. Other drugs or other infections and diseases go around. All right, and you do not want to be part of that, or have a health concern because you're trying to help somebody. All right, alcohol is getting more prevalent for us. Okay, the cops used to handle that mostly on their own. Now it's a medical issue, and now most intoxicated patients will be transported to the hospital, and then the cops will deal with them after that. Okay, so again, let's talk about alcohol, right? We know about the liver damage, we know about cirrhosis. Okay, we know about binge drinking and then withdrawals. All right, but let's talk about the actual call with an alcohol involved person. What do you think the legal ramifications of decision-making status is? Right, it's altered mental status. So now what kind of position does that put you in from a legal standpoint? Huh? You would transport them, right? You have to, but now what happens when you have the belligerent drunk who doesn't want to go to the hospital and wants to RMA?
Then you call the police.
Okay, what if the police don't want to do anything about it? Which happens quite often because he's just drunk and they're like, well, I'm not going to 941 him because he's just drunk. Right? So they're not going to put him in for a psych hold, which is the only way they can do it. Well, worst case scenario, you're going to do your RMA and you're going to document very thoroughly why it's an RMA, but we should not be RMAing like drunk patients because theoretically, according to New York State, they do not have the capacity to make their own decisions at that point. However, we all know some drunks are not the most pleasant people and are not just going to happily get up in the truck and go with you. Okay, so in the state of New York, we legally have a duty to take them to the hospital. All right, because they are altered. All right, it is a depressant. Okay, so they, depending how much they've had, right, can go into respiratory decline and or respiratory distress / arrest. Okay, slows the reflexes, reaction times, decision-making abilities. Again, depending on, we used to say like Jack Daniels causes people to get angry, right? Certain people have certain triggers. Certain people drink for certain reasons. All right. So people can get aggressive. They can get aggressive real quick. All right. They may be inappropriate. All right. And some people will double dip. All right. Alcohol, for whatever reason, acts as a magnifier for other drugs. Okay. So some people do other drugs and then drink on top of it and try to get that increased buzz or whatever they're looking for. Okay. We all haven't gotten to the vomiting point of drinking one night, but most of us who are over 21 have probably had that one night where we've had a bit too much and ended up by the toilet. All right. So just be careful. All right. Monitor the airway. Okay. And then depending on the level of withdrawal or where they're at, you may see some tremens, DTs. All right. It's little what's the word I'm looking for? Uncontrolled. That's it. They're uncontrolled little muscle twitches and tremors, usually in the extremities. All right. They may start talking to people. They may have hallucinations. Okay. All depends on what they drink and how much they drink. Okay, so if you do get someone who is in withdrawal or in the DTs, as we call it, all right, they're probably gonna be agitated and restless because their body is craving a substance that they don't have or that they're not giving it right now. All right, they're definitely having a problem. Could have a fever, they're definitely sweating, they have those uncontrolled muscle tremors. All right, they might be confused, disoriented. Again, they could end up in seizures, which is mostly what we're worried about. Okay, because that body has become so so used to the alcohol and that chemical dependency, all right, that it almost creates like a homeostatic environment with it in there. So when you take that out, the body's trying to get back into that homeostatic state, and it doesn't know how because, right, we can't just produce our own alcohol. That might be fun, but no, definitely would not be fun if we could produce our own alcohol. Again, these people might become combative too, because you may have family members that call, right? And this person really just wants to get up and drink another beer, but the family's like, no, you've had enough, you're going to detox. And they're like, no, I'm not. All right, so again, have police standing by, all right, just for safety's sake, especially if it's like a third party call or family's insistent or something like that. All right. So opioids we kind of touched on, right? Their pain management, there's multiple different types. Okay. Originated from the opiate in poppy seeds. Okay, which we got codeine and morphine from. There is a thing out there like you can test positive if you eat poppy seed bagels, and you'd have to eat so many that you'd be sick and tired of it for it to pop up in your tox screens, but that is where they came from. Okay, it comes from a flower. I forget what part of the Orient, but it started in the Orient somewhere. Not that any of that's relevant, but it's fun to know things. Okay, so these are common ones we're going to find. So heroin, Vicodin, Dilaudid, and the Oxy are the ones that you're going to see most often out there. Not many people have fentanyl. Sometimes they have fentanyl patches, but it's kind of hard to overdose on a patch. I don't really know how much Tylenol with codeine you'd have to take to overdose, but I don't even think that they don't prescribe that too much anymore, do they? Not very often. Usually you take it in the hospital, but they don't give it out like for home. Is that like Tylenol 3 or something?
I got that for my wisdom teeth.
No, yeah, not you personally, but I'm just saying like Tylenol 3, like they give it in the hospital, but they don't give it out to people anymore. Yeah, it's not a thing. Right. Right, because isn't even the Sudafed with codeine, right? Because it's used to make meth, so you have to sign at the pharmacy even if you want Sudafed. Yeah, they take your name, your license, all that stuff. Yep. Yeah, because we're all meth heads. Right. So just be aware of these. Okay. Again, prescription drugs are the most abused, and then don't have to be the person with the prescription. Okay, it could be someone else in the house. Someone could, because none of us, we're all upstanding citizens, but nobody would fake pain management to get extra pills to go sell it for $50 a pop on the street. Right, that's not a thing. Nobody does that. Okay, so just be careful. Right, again, these are CNS depressants, so you're going to have nervous system type symptoms. All right, we talked about the tolerance. Okay, again, the longer you do it, the more you have to take to get that same feeling. All right, you will see nausea and vomiting. They will be hypotensive. All right, they will be respiratory compromised and possibly cardiac compromised. All right, seizures are very late stage. They're very uncommon, but just be aware you may see one. All right. And again, by the time someone calls, they're usually unconscious, unresponsive, possibly cyanotic if they're not breathing. right? Pinpoint pupils. If you see pinpoint pupils, give Narcan. All right, Narcan is very benign. Doesn't have very many contraindications. All right, it takes about 5 minutes to work its way out. Well, no, not 5 minutes to work its way out of the bloodstream, but it'll last for about 30 to 45 minutes. Okay, but there's no real serious side effects with it. So even if you don't know what it is and you just want to try it, because that's, you know, synthetic opioid stuff out there, sometimes it works, sometimes it doesn't. Sometimes it works and it shouldn't, and you're like, I don't even understand. I've had it happen twice where the problem had nothing to do with it and the guy wasn't breathing and I shot Narcan, all of a sudden he started breathing again. And I'm like, sure. So I went down that rabbit hole, but that wasn't the right rabbit hole to go down until I found the other one. Right. So again, Narcan, IV, IN, or IM and IN. IN is intranasally. That's the way you guys are going to do it. Again, try not to get it on an inspiration. Okay, try to get it like in that pause in between, because if they inhale it, most likely they're going to aspirate on it, and you want it to absorb in the mucous membranes of the nose. Okay, so, and again, make sure they need it. All right, you can be unconscious and breathing and be fine. All right, I tend to like my overdose patients unconscious and breathing. All right, but if they are in severe agonal respirations or not breathing is when you're going to want to hit them with it. All right, don't wake them up. They fight. Be safe. Okay. Again, cops have Narcan. Detoxes give Narcan out over the counter to people going home, so that if they shoot up in their house, like their family can give them Narcan. So someone may have already done it before you get there. All right, if he was given 12 milligrams of Narcan and he's not waking up, it's probably not Narcan. All right, probably not an opioid. They tried it. All right, so then we're gonna go down another road and try to figure something else out, right? Like I said, it could be one of those anticholinergics or something. So check the pupils. Pupils are the telltale. All right, again, barbiturates and benzos. Okay, they're exactly the same, right? They act pretty much like opioids. They'll have the same set of symptoms. So again, these ones, right? What's the difference? What's their pupillary response? Right, they're gonna be big, dinner plate size, right? So that's how you're gonna tell. Most often they're pill form. Okay, sometimes they will dissolve them in water. Sometimes they will do them IV, right? I don't know where you would, bless you. I don't know where you would get like IV Versed from, but if you did, right? And of course, some of these are like Eurohypnols, your knockout drugs, right? Make people unconscious, take them out, do things you don't want to do. Okay. Again, everything we do in the last two chapters has all been aggressive airway management. All right. And quick transports. That's all we can do for these guys. Okay. Inhalants, most commonly acetone, toluene, xylene, and hexane. Again, your paint thinners, your glue huffers. Okay. Some people like to sniff gasoline. I don't know why. I think it stinks. I swear they added some kind of new thing to it, because every time I go to the gas station, it's horrible now. Like, it makes me nauseous to go to the gas station. Whatever the smell is in the new gas is just, I can't do it. I like hold my breath when I'm pumping gas now. It's horrible. I don't know. I know you're looking at me weird, Joe, and I don't get it either. I really don't. I've never had a problem with gas until COVID. And then like whatever this new additive in the COVID gas are giving us. But it smells. That's what I call it. I call it the COVID gas. I swear it's different. I don't know what it is. It's got just this weird, like, not even sulfur, but it's got like, because the diesel smells like sulfur, and that's okay. But this is just like, if I stand next to someone whose car's running, I can smell it in the exhaust. It drives me crazy. It's horrible. I don't know what it is. All right. I know you're all think I'm crazy, but I swear it's out there. Okay. Again, sniffing gas can cause heart problems. All right, so keep them from struggling or exerting themselves. All right, do all the moving for them, give oxygen, get them to the hospital, right? Don't let them do anything. I tend not to let anybody do anything anyway, unless they have to walk. All right, so here's your sulfur stuff. All right, hydrogen sulfide is highly toxic. It's colorless, it's flammable, and it has that sulfur odor, obviously. Okay. It will affect everything. All right, but the most important thing is that it's, again, all of these are respiratory and nervous system problems that happen. Okay. Again, it's most often used to commit suicide. Anytime, right? We talked about this hazmat, right? Anytime you suspect any type of gas or anything, right? Hazmat, because we got to protect ourselves. So just like everything else, nausea, vomiting, confusion, altered mental status, seizures, shock, coma, cardiac arrest. Okay. And then decon is the most important, right? And then again, aggressive airway and transport. All right. So these are a couple of the uppers and their street names. I don't even know what we have around here anymore. I don't know if anybody does PCP anymore. Cocaine, I know cocaine.
PCP can confirm.
Okay. So there's still PCP in the area. Ecstasy used to be a thing. I don't know if ecstasy is a thing anymore. I've heard some people talk about Molly lately. They're all kind of the same drug.
I've seen them pass through.
You can always tell, especially if you live in the Hyde Park area, because you can tell when the new shipment comes up from New York City. Because like you'll be fine for like 2-3 weeks, and then all of a sudden one weekend you'll do like 8 overdoses in the Hyde Park area, and all of a sudden you know, and like that's the drug that's coming through, and you'll figure out what it is real quick, and then you'll know that it's just a bad batch of whatever's coming through. And sometimes it's fentanyl, sometimes it's, you know, ecstasy or whatever it is. But yeah, it's usually in Hyde Park. I don't know why Hyde Park gets it first, but it's usually Hyde Park, and you hear it, and she's just shaking her head because she's from Roosevelt and she knows. Like it's just. Yeah. Yep. Yep. Oh yeah, you always know when the new batches get shipped up from the city or wherever all the drugs come from around here. But and it always seems to, like I said, it always seems to hit Hyde Park first. Now we got a couple over in the Dover, Wassaic area, but you don't get nearly the amount that you get in Hyde Park. Like Hyde Park has some serious drug problems. So I don't know what you see in Ulster County, Joe, but what? Oh, the overdoses in Kingston. Oh, well, that's nice. Right. So again, just be aware of the types of drugs that are out there. Everybody from different areas, you probably all have your own special types, and there are the new designer drugs and the new synthetic versions coming out. So heroin lately. Nice. All right. So we talked about these hypertension. They're right. They're the opposite of your other ones. Okay. They can be taken by mouth or by IV. They can be smoke snorted, injected. I know of a guy who used to put the LSD tabs on his eyeballs while he was at work because it would dissolve slower than if it was in his mouth. So he would take the little square tab of LSD, put it under his eyelid, and go back to cooking. So, it's a seafood restaurant. It was a seafood restaurant on the shore up in Maine. mostly seasonal. We had January, February off, but like the summer months, it was so busy. Like you were running for 12 straight hours. So his response to that was tabs of LSD in his eye. Chefs are special, man. Chefs are special people. We do some dumb things. That's why I got out of that business. I couldn't hang anymore. I could not do the things that were needed to be done. I didn't want to. All right. So again, any type of overdose is obviously an emergency, right? Seizures, cardiac arrest, strokes. All right. Again, obviously do not leave them unattended. That's called abandonment, right? Bath salts, right? Are we still doing bath salts? Is that still a thing? I haven't heard bath salts in a
Actually,
while.
haven't seen it.
Right, since the guy ate the zombie, the bath salts, right? So again, depending on the bath salts, right? This one says increased mental clarity. Possibly it goes the other way. It's definitely mostly euphoria. Okay. Just be aware of what's in your area. All right. Look for the muscle twitching, the lip smacking, right? Paranoia, headache. You know, the ones that you tase and keep walking towards you, salivating, saying they're hungry, probably not a good thing, right? Try to do your best, keep them calm in transport. I'd let the cops handle it. I don't even know if I have enough ketamine to put these people down, to be perfectly honest. All right, sometimes they're a little crazy. Marijuana we talk about, but now that it's becoming, go ahead.
What's the difference then between alcohol impairment and narcotic impairment in terms of police? Like if they could turn down the person who's been drinking, then why can't they turn down the person who's high?
Narcotics are illegal.
They most often do because they have the brand new don't ask, don't tell policy. So like you can, as long as you overdose and you go to the hospital and seek help for your drug addiction, they will not do anything about you having like whatever drug you have in your house. Like they'll confiscate it, but you won't get in trouble for it. There'll be no, you won't get arrested. You won't go to jail. So the cops have a very don't ask, don't tell. As long as you go to the hospital, you're good. And most people end up going to the hospital. Again, just for observation to make sure that they don't go into any of those cardiac arrest, seizures, respiratory arrest, stuff like that.
So you're saying the people that are out of their mind high versus out of their mind drunk, the cops are going to take the out of their mind high people, but not the out of their mind drunk people?
No, everybody goes with you.
Oh, everybody goes with the.
Everybody goes with us. Yeah, they don't take.
Oh, fun. Okay.
Unless they are 100% combative and need to be in handcuffs, and then most likely they'll be handcuffed to your stretcher and the cop will come with you, but they still go with you because it's still medical. I had one car accident where this guy's knee was, I swear his knee was beyond jacked up. Like it was swollen. Like there was a big lump on this side of it. Like it looked like he had thrown his knee out. His car flipped 4 times, took out a fence, like a big thick pole fence, like a farmer's fence. And he was sitting there and he was agitated and pissed off and didn't want to be there. And his family was like, we're done. You're going to jail. I don't care about you. Get out. Like they were gaslighting the whole situation. And he's sitting on the ground and I'm like, dude, you need to go to the hospital. Like this knee is messed up. He's like, no, I'm not going. Like, dude, A, you're drunk. You like, I can't leave you here. Your knee is screwed up. Like it's pouring buckets. Like, let's get out of here. Nope. So the cop's like, I'm done. He's like, does he have to go to the hospital or not? I'm like, no. He needs to go to the hospital. She's like, all right, well, what do you need for him to not go with you? I was like, if he can stand up and walk, I was like, I will let him go to jail first. And then you will take him to the hospital when you're done processing, right? She goes, oh yeah, he's going to the hospital tonight, one way or the other. And I'm like, all right. This man literally hopped up and like started like walking with the cop. And I'm like, all right, man, I guess it's not as bad as I thought it was, but yeah, I swear to God, it looks so jacked up. I thought it was broken, dislocated, like all that good stuff. But nope, she took him to jail first. did the processing, probably, and then she was going to take him for blood work to get an blood alcohol level on him. But yeah, he didn't go with me. That's first and only time. But he was being so belligerent and just ridiculous that she was like, nope, I'm done. If you say he can go, and I'm like, well, I mean, he really shouldn't, but if he can walk on it, we'll call it a day right now. So he got up and walked, and I swear it had to be the alcohol, because there's the way it looked, there's no way he should have been able to bear weight on his knee that the way it looked, but it is what it is. All right, so marijuana is now more legal, okay, in most places. So we don't really do too much with this anymore. The only thing that we really need to get out of marijuana, I don't even know if I have it in here. Depending on what it could possibly be laced with. All right, people do lace marijuana with other things. Certain strains are more potent than others, depending on how much they're spending for their weed. All right, and right, the edibles, I'm not worried about all that. Ah, there it is, I do have it in here. Okay. If you ingest too much marijuana at one time, you can get this lovely thing called cannabinoid hyperemesis syndrome. You will start retching uncontrollably and vomiting, and you will not be able to stop. And it will cause severe abdominal pain, and it's actually pretty gross. Like, I've seen one person with it, and the treatment is, oh, what is that damn thing I have that I never use? This is why. There's one drug in the drug box that we have, Haldol. So Haldol will actually stop the stomach from twitching and the abdominal cramping, and relax the muscles, and will actually stop them from vomiting due to the marijuana. This is mostly in your chronic marijuana users, people that do it quite often and do it quite excessively. All right, your first time people should not have this problem. Okay. But just watch out for it. Okay. It's a lot of vomit. That's why it's called hyperemesis. All right. They will continue to vomit. All right. And then the abdominal pain comes in because they're using all of those muscles, and everything gets tired and they cramp. All right. So all that good stuff. It's a mouthful. It's hard to say. All right. Just know it's out there. It is a thing. Okay. And then the new synthetic marijuana that they have out there. All right. We're not really sure what happens. I haven't come across any of it. Okay. They just, depending on what they're doing, it really depends on what they're using in the synthetic blend is how it's going to react and how the patient's going to react to it. Okay. So this is the type where you're going to want someone there to let you know what they were doing. All right. This is where you kind of need to know, or we're just going to go under the dummy assumption and we're just going to aggressively manage the airway, get them to the hospital, let them do blood work and figure it out. Right. But if you can get that information, get that information. Okay. Yeah, where are we at? What time? Let's see, how much more do we have in toxicology? Oh, we got 20 slides. All right. Take 10 minutes because I want to take 10 minutes and then we'll finish toxicology. All right, take 10 minutes. And then we'll finish toxicology. We'll be somewhat caught up. Oh, there's my LSD. I just got to it early. Is this your guys' stuff? Cool. Does anybody leave their folders with them and hasn't gotten them back yet? I got yours though. Because I could have swear someone said they left a folder, but no one can find them. And I want to make sure I have them all.
I did leave my folder with the people I was with.
Yeah, who was that?
It was Sarah and Jolene.
Okay. I have Lucy. Huh? Thanks for what? 12 hours of your life you'll never get back. You're welcome. Huh? Yeah, I mean, sometimes it happens. All right, this is Neil's. Where's my? Oh, I can't do that right now. I have Emma's. And I have someone who didn't fill anything out. Oh, Gianna. Gianna, you're not done with yours yet. You're not done with your folder yet. I need you to do your evaluation of your people. Huh? What? You have to do your evaluation. I mean, it means your evaluation of your clinical rotation. So you need to put down your name and who your preceptor was, and then you have to evaluate them. And let me know that if they should be preceptors or not be preceptors. Okay. See, those are things I don't have your folder.
I also did not fill that part out.
Okay. Who else didn't fill this out? Whoever this is. This is probably Joe's.
Mainly because she said she was gonna fill out what she needed to and then leave it on Sal's desk. And I was like, okay, cool.
All right, so I gotta find. All right, so Kayla's I have to find somewhere. This is Dave. Dave did his. Joe did his, but I don't. Unless do you want to do yours or no? Yeah. I mean, just so I know if I should give those people riders again or not. Otherwise, it's not. Okay.
Oh, personally, then I don't need to fill mine out because they were great.
I feel like you're lying to me because the text I got at 8:30 in the morning that said, "Why am I here? They don't know anything, and what am I supposed to be doing?" tells me that they were not as good as you think they were.
I didn't send a text.
No, Joe. It was, I paraphrased. That's not exactly what he sent me. Luke is pretty good. All right, so I gotta find.
I believe they said that because when I arrived, their report was, we didn't know you were coming. Nobody tells us anything.
I mean, that is true. I didn't tell them they were coming, and you weren't on the schedule for that day until I put you on Saturday night. So you were kind of a surprise. That's on me. I didn't tell them you were coming. I did print them out a nifty little schedule that had everyone's name on it and what day they were coming and who they were riding with, so that I didn't get that answer because that's usually the answer they get when someone else is in charge. But they may have a pen I can use real quick. I just want to write down whose folders I have to find. Mark, did you do yours? Did I reschedule yours or no? No, and you have your folder, right? Okay. So I have to find Kayla's folder. Phil, your folder's still out there, right?
Somewhere.
Okay. Melanie, do you have your folder?
Yes, I do.
Okay. Taylor, you have your folder?
Yeah, I do.
All right. John, you said you had your folder, right?
Yeah, I got mine.
Okay. Who else am I missing? I feel like a bunch of people have gone and I only have 5 folders back. All right, well, Gianna's working on her, so that'll be 6 folders. I really didn't want to have to turn this off to put it back on again, but I'm going to. That's not it. Julian. Julian, did you go?
Yeah, I went. I still have my folder.
You have your folder with you? Okay. Lara, what about you? Oh, she's not in the corner of the room. That would help. John went, Patrick handed me his. So you're going, so you get green now. All right, Joe went, even though not on this day, but that's fine. Joe is green now. Why did it not save? John went, Taylor went, Kayla, I have to find Lucy's folder I have. Gianna's folder I have. I'm going to talk to Jolene about handing these folders in. Seems to be a Jolene thing. Because Phil was with Jolene. Mark would have been with Jolene. All right, so Taylor has hers, Melanie has hers, Julian has his. I'm looking for Kayla's, Phil's. Lara, are you back in here yet? What do you have your folder from your ride time? Okay, but you actually have it. You have the physical. It's not left at the building somewhere that I have to go find. Okay. All right. So I'm just looking for 2 then. Sounds good. All right. So where to go? Those of you who went and have your folders with you are going to be yellow. Mark, we need to reschedule, right? Okay, we're going to come out of here. Let's when are you actually wait till the end and I'll log in and we can schedule you. You tell me when you want to go and we'll because I think they're only going on Wednesdays, so we still have other options to get people in. When you guys get back, I'm gonna have to get with Sal though and figure out how to get you guys in on the weekends. Huh? Oh, Wednesday? Yeah, some days are better than others. It's hit or miss. I thought there would have been some pretty decent ones because of yeah, the ice and the snow. I figured there would have been people doing MVAs all morning. No, Green County was good. There was no problem. Is this yours, Gianna? Oh, she left. She did bring it over. Okay. I love driving to work because it's always fun to see the shenanigans because Greene County is perfectly clear. They get out all night long. I hear them drive by my house 42 times. You get out, the road's perfectly clear. It's like it's raining. You get into Columbia County, there may be a little bit of slush, right? But for the most part, it's clear. You get into Dutchess County and all hell breaks loose. Like the roads aren't done. Like there's 6 inches of snow on the ground. Like you come in and it's right at the county line too. You'll be doing 45. All of a sudden you're like, crap. Like don't slam on the brakes, but really start slowing down because you're about to fishtail out of here and be in trouble. But yeah, you can see like how all 3 counties do storm management and it's ridiculous. Yeah, but the river too depends because like he said, this one we really didn't get anything on the, what is that, the western side of the river. We didn't get like Ulster County, Greene County. I got 1.5 inches of snow and mostly slush. Right.
Oh, it was icy when I went in.
Oh, when I came in, it wasn't too bad.
So the really fun thing with percent chance of like precipitation is it doesn't mean like the chance that you'll get like it will rain. It's the percentage of the county that will see rain.
I feel like that's your interpretation of that, Phil, but it's really, it works out. Phil said the chance, the weather percent chance is not the chance it will, it's the amount of the county that will see the precipitation. Like, I don't know if I wholeheartedly agree with that, but.
It's how one of my friends in weather explained it to me.
Oh, that's what so someone who's in meteorology actually does it.
Yeah.
That makes sense then. I mean, it doesn't, but I'd much
Well,
rather know
It
the,
didn't make sense to me either, and I don't know how much I believe him, but that's what he said.
right. I'd much rather know the chance of it actually happening versus the amount of the county, like, cause I like, am I in that 50% of the county that's gonna be affected or no? Like,
well, that's just it. That's the odds play out the same way. If it's in 10% of the county, you have a 10% chance.
I think they just explain it to make themselves sound useful because I mean, literally it's the only profession that you can literally be wrong every day and still have a job at the end of it because it's like, well, we're just predicting a model. We don't really know. It's like, wish I could just predict a model and get paid for it. Like,
we were right 63% of the time, just got really darts. But they're like 71%. They had all the technology.
I don't know. Like I said, it's a weird job to get paid for. All right, let's get back into it. So hallucinogens. All right. Hallucinogenics obviously alter mental status. Okay. Obviously, if you're doing Toad, right? Thanks. At least one other person watches Family Guy in here. Right. Ketamine does the same thing. We were talking about LSD earlier. Peyote is more of the Native American example of marijuana. Morning Glory, I thought was like lethal toxic. It is a pretty flower, but you can mash it up and hallucinate balls off of it. But I thought it was like toxic. Like I didn't think it was one of those like things you do on a daily basis because nutmeg is the same way. PCP mushrooms, right? And then obviously the salvia, that's the newer one. I thought it said saliva too, but I always have to stop myself. And then it also, right? Isn't it like it's a flowering plant, but isn't it also one of those sugar substitute things? Or is that something else? Like I got that confused with it too. Huh? Yeah, no. It's also hallucinogenic though if you snort enough of it or ingest enough of it. Not that I would recommend snorting nutmeg because that would have to burn like hell, but yeah. Yeah, you can get it in pumpkin spice and by itself, but so it's the Morning Glory seeds. And they are hallucinogenic, but they can also lead to diarrhea. And it says it's not, I thought they were directly toxic, but this one says it's not directly toxic, but in large enough quantities. It's not digitalis.
No, but that's cardiac.
Yes. Yep. So apparently a near record number of 8th graders were going to the store to buy morning glory seeds. Outstanding. So apparently you need between 300 and 400 seeds. Apparently banana peels. Apparently if you smoke banana peels, nutmeg, this is myristicin, which creates hallucinogenic effects if consumed in very large doses. Many users get high, but serious side effects like extreme GI problems and flu-like symptoms. It takes several hours to kick in, so most people overdose because they think they have not taken enough because they don't get that. It's not an immediate high. It takes a while. But yeah, there's apparently whatever myristicin is. What is? Let's see what that comes up with. So you bake a muffin and you get high at the same time. Oh, apparently it's an insecticide. The myristicin, the thing in nutmeg that gets you high, it's a psychedelic, and they use it in insecticides. Cool. Now you know. Is Connecticut the nutmeg state? I don't know. Okay, so the only thing we're really worried about with hallucinogens now that we just got off our side tracks is the bad trips. All right. Usually people who do it their first time will have someone help them through it. All right. Because if you go on a bad trip, you can freak out and the anxiety, the paranoia, and the tachycardia will get to you. Okay. And you end up with cardiac problems. And that's really what we're worried about. So you want to be calm and, do not play into the hallucinogen or the trip. All right. Provide emotional support if necessary. It's almost like people coming out of anesthesia. You see the anesthesia videos, right? Where like the parents will mess with them and they really think it's happening. Okay. It's kind of the same kind of concept. All right. So you really kind of want to be there for them, even though they did it to themselves, but it is what it is. Again, don't restrain them. It could alter the hallucination and they could hurt you or hurt someone else. All right. Again, we leave anybody unattended because that's called abandonment, right? No one wants to go to jail. And in the worst case scenario, if you cannot properly manage the patient, let us know. I will not always sedate someone when I get there, so do not expect it to happen. All right, just that is my decision to make. It's not yours. I'm not going to come on scene and be like, you're going to sedate them. I'm going to be like, probably not now. Okay, I don't like being told what to do. That's just me. Okay, especially with sedatives. All right, I don't really sedate many people. They have to be seriously like delusional and about to like hurt everybody. But I've had a couple of people, especially around here, call for me to sedate them so that they can remove them by force from their house. And I'm like, but why? Well, because she has dementia and she needs to go to the hospital. Is dementia a reason to go to the hospital? Like, I get it, the family's a little tired and wants a break, but that's not a reason to send someone to the hospital. And at this point, they were like, well, she's completely altered. And I asked her all the same questions and she knew all of the things. And then EMT on scene was like, well, you need to sedate her so we can get her out of here. And I'm like, no, like I'm leaving her right here. She's going to stay home. They're like, we're not here to remove people forcibly from their house so that the family can take a break. It's not how this works. But I was like, and I asked the cop, I'm like, what are you doing? He goes, absolutely nothing. He's like, she can stay here as far as I'm concerned. She's perfectly safe. And I said, absolutely. And I agreed. And we both walked away. Me and the cop left the scene. We left the EMT and the volunteer crew there to figure out what they were going to do. But so
It sucks seeing as many dementia patients as I do up on 5.
right. I mean, when Phil was like it, he sees a lot of people where he works that have dementia. It's a horrible thing, and I feel for the family, but that's not, unless they're having a medical emergency, that's the hospital's not a break time for you to go out to dinner with your husband because you don't want to leave grandma home by herself. So, and I've seen that happen too. There's a horrible misuse of resources out there sometimes. But okay, so the anticholinergics we talked about, right? These are your parasympathetic blockers. All right, this is kind of the thing that we use: hot as a hair, blind as a bat, dry as a bone, red as a beet, and mad as a hatter. Okay, these are your symptoms. All right, they'll be hot, they'll be flushed. Okay, they'll be dry, right? They'll have that like sludgem kind of feel. Not so much blind, but they may be having visual disturbances. They'll definitely be either agitated, anxious. All right, Benadryl is one of these. Jimson weed, amitriptyline. Sometimes people overdose on their medications. All right. What's up? Or is that you? I don't know. Someone has their microphone on. I can hear like, I didn't know if someone had a question. Sometimes when I hear that's you. Okay. There's also tricyclic antidepressants out there. I'm trying to think of the most recent one that the guy had. I just had somebody who did this. He tried to commit suicide taking his medication. And I felt bad because he was like 70 and his 70-year-old wife is in there, and like he didn't need CPR yet. They put a pulse ox on him and his pulse was like 50, and they were like, his pulse is going down. And I'm like, okay, but like he still has one, so we're good. Like, I'm not worried about it yet. I can fix this. Like, I have the antidote right here. Not a problem. We can do this. Right. But like, she's on there and she's literally like doing, and the people at home won't be able to see it, but she's got both hands on the guy's chest and she goes 1, 2, 3. And I'm like, what are you doing? She's like, CPR. And I'm like, his wife. And the daughter was a CNA, and she had the pulse ox from work and put it on his finger. And the wife's like, look, it keeps going down. It keeps going down. And I'm like, but what are you doing? And she was only pressing like a ½ inch. Like, she wasn't even pressing his chest down. And you could see the pulse in his jugular vein. He had JVD, and you could see it going ting, 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 like in his neck. And I was like, all right, madam, I'll take it. Just please step over here. But it was like, I was like, what I mean, when they had said CPR instructions were being given over the radio, I was like, okay. And then I got there and I'm like, what is going on? Right. But a little bit of calcium and some bicarb, and this guy was fine. Right. So, however, his heart rate probably was going down. Okay. I mean, she really did have a reason to be concerned. All right. But what they were doing was not going to help anybody. Okay. So again, if you end up on a scene like that and there's someone actually trying to do something and they're doing it completely wrong, like, thank them. All right. Tell them I'll take over. Okay. Slide them out of your way. All right. Don't just be like, get out of my way. You're doing this wrong. Like, stop it. All right. Don't dismiss them. All right. Because they're trying to help. Okay. And then, yes, with these, call us, meet us somewhere. All right. Or get them to the hospital. Okay. Your nerve gases. All right. These are overstimulations. Okay. Most oftentimes around here, you'll get the organophosphate insecticides on the farms. All right. We have little kits, anticholinergic kits in the ambulance, that we can give an IV and drip this stuff in. Every ambulance only has one, so it kind of doesn't help very much. This is another one. Okay, we did sludge them. They're doing dumbbells now too. They're kind of the same. All right. So the D stands for diarrhea. It's the same as the G in sludge them, gastro problems. Right. The U is the same, urination. The M they changed to the meiosis, which is the same in sludge them. Bradycardia, bronchospasms, bronchorrhea, trying to think of what part of sludge them that is. That might be the new part. Emesis is the same, lacrimation is the same, seizure, salivation, sweating is the same. All right, so they might have added the B in. Otherwise, I mean, it's all there. The only thing missing is what, the G, and it's the same, right? But just in case you see it two different ways, all right, it's out there. Okay. Again, it's right here. What did, so what is the other one? Bradycardia doesn't, yeah, it doesn't really fit into this one. So maybe that's why they changed it, because you will see the bradycardic in the heart, the cardiac aspect of it too. All right, but just know they're the same. All right, you can use either one you want. Okay. Again, I shouldn't have to say this at this point in the class, but your safety is obviously the most important, right? We are not going to get ourselves exposed. Okay, unless you don't know what's happening until you walk in, and then, right, that's an accident. But decon is the most important. All right, additional resources, suction, and aggressive airway management. I don't know how many times I have to say it. All right, some people have the duodote auto injectors. Okay, they have the two different medications in them. Other people, it's a kind of sludgy white IV kit, and we'll just put that on. Okay, again, use it on yourself first if you need to. All right, manage their symptoms. Okay, but if you get exposed, fix yourself first. All right, most people don't think about it, but fix yourself first. All right, if you go down, then who's helping everyone else? All right, again, there are millions of medications out there. There are millions of ways to get high. Kids are finding new and more fantastic ways all of the time. Okay, the only really way to keep up with it is to do the research, find out what's in your area, find out what people are using, and then learn how to counteract it. Okay. And it's literally could be anything. Could be their own prescription meds, could be anything from under the counter, whatever. Kids are stupid. They dare each other to do stupid things. Okay. Again, poison control, right? Put it in your phone if you have to, just in case. So you're not looking around for the number when you need it. All right. That's a good resource to have just in case. Aspirin poisoning. I think we talked about this, right? About how much aspirin they need to take. Didn't we? Because didn't you ask about that the last time we were like in cardiac? Yeah, it's like, it's a bottle, right? So it is a thing, okay? But in an acute cardiac setting, all right, if they've only taken 324, you can give them another and you're safe. Don't give them over 3,000 milligrams, right? Clearly, okay. However, you can overdose on aspirin and people can try to do dumb things, right? So ask them what they took if you see an empty aspirin bottle next to them. All right, the ringing in the ears is your clue. All right. Again, anxiety, confusion. They might be hyperventilating. They'll definitely be warm. All right, they might say they made a mistake. They messed up. Okay. They might have no, like, don't realize what they did was actually going to be as dangerous as what happens. All right. Anytime you overdose, there's always a chance of seizures. All right, so just be careful. Literally, everything you take can cause seizures in abundance. All right, so Tylenol is the other one. All right, Tylenol and ibuprofen. People try to take too much of. Lately, I've seen a bunch of melatonin. Melatonin's another one, like aspirin, you have to take like 500 grams. Okay, if you take 5 melatonin pills, you're gonna have a really good night's sleep. That's literally all that's gonna happen. You may have a little upset tummy in the morning, but for the most part, you're fine. All right, I try not to even take melatonin to the hospital because they're just like, what do you want me to do with it? Watch them sleep? And I'm like, yeah, pretty much. They wanted to come. I don't know what to tell you. All right. Some people, and I can't believe they do this, and I watched it happen in the psych center in Baltimore when I was picking a patient up to transfer them to another psych center. The gentleman had a styrofoam cup and he was going up to the hand sanitizer dispenser, and he would put the cup under and the automatic hand sanitizer would dispense a shot of liquid, and then he would shoot the hand sanitizer so that he could drink alcohol. And yeah, special things. Special people do special things, right? So some alcohols, right, are more toxic than regular alcohol and require interventions. Apparently, the hospital was not really concerned about it all that much. They just kept. I was like, "Do you see this guy over here in the corner?" They're like, "Yeah, whatever." I was like, "Oh, okay." Let's record the last 15 minutes. Yeah, no, the methyl. So ethyl alcohol is drinking alcohol. All right, that's your beer, liquor, wine, spirits, your grain alcohol. All right, that's all that. Methyl alcohol and ethylene glycol are your like cleaning alcohols, like your sanitizers, your antiseptics, stuff like that. Okay, so they're more concentrated and they have different chemical compounds. All right, but they are more toxic because it's a different compound that your body's trying to break down versus just organic alcohol. Why is the yes, no? Are we just not going to do anything? No, it's working up there, but not working over here. Okay, I really don't care as long as we get through the last couple minutes. All right, food poisoning. All right, we've all dealt with food poisoning before. Some sort of bacteria on the food either came from the people picking your food, not washing their hands properly and getting it on it, and then you eating it immediately at the farm stand, right? Strawberries, berries are usually pretty good ones. Peaches, apples usually have the waxy coating on them. So as long as you rinse them under hot water and get the wax off, you're usually pretty safe. Okay. We got two different types. The bacteria itself may cause the problem, or the bacteria will produce toxins that cause the problem. Okay. Again, these are all the good ones. All right, we're not going to talk about all of them. Botulinum is a good one. E. coli is a good one. Salmonella, Staphylococcus, right, the norovirus. Okay. Salmonella, we all know, comes from raw food, right? Okay. So Salmonella causes severe GI symptoms, usually within 72 hours. Some people who immediately eat something and then start having problems, like I think they had something going on prior to, okay, because it usually does not come on that acutely. It can be within 24 hours. So it should say within 24 to 72. All right, but it's not immediate. All right. Again, make sure everything is cooked to the proper internal temperatures. Okay. Make sure you don't cross-contaminate things. Don't put your salad on your cutting board you just cut the fish on, right? Wipe things in between. Make sure things are clean. Clean your knife. Don't use the same knife, right, on raw chicken and then cut the vegetables that are going to go with it. Okay. Even if you cook them, you may not cook all of the bacteria off. right? That's just not a good idea. Okay. So Staphylococcus is one that produces the toxins. All right. Again, unrefrigerated food. I don't know how many times in college we had pizza left over from the night before that I would eat in the morning. Right. Probably not a solid idea. I never got sick from it, so I never really thought about it, but nowadays it probably wasn't a great idea. Okay. These ones are your quick acting ones. Okay. These ones they'll usually be 2 to 3 hours after you ingest it, because as soon as those toxins start getting produced is when you're going to start having the reactions, versus the bacteria that has to grow and cultivate first. All right. Botulism is the worst one. All right. Usually comes from canned food. Most oftentimes it gets reported on the news and they ask you to bring all the food back right to the store where you bought it from. Okay. Blurred vision, weakness, difficulty breathing or speaking in between breaths. All right. They're mostly neurologic. Is it the same one that they inject? Right? Is it a dead strain that they use for the injections, or Mark? The botulinum? I wasn't sure if you did or no. Again, we don't really care. Okay. We're not going to figure out whether it was botulinum, E. coli, salmonella. All right. You're going to tell me, yeah, I had chicken 3 days ago. It kind of smelled pretty bad, but I figured I'd eat it anyway. Like, all right, good, cool. Got it. Figured it out. Right. So history taking. All right. And then if there's more than one person in the same household with the same problems, okay, and they ate the same thing, right, suspect food poisoning. All right. Plants. Again, foxglove, he was talking about the digitalis, right? There's mistletoe, rhubarb, nightshade, obviously is a poison. Okay. All these things can cause problems. People like to go out and pick plants and eat them. Sometimes they pick the wrong ones. Rhubarb, if you don't cook it properly, right? So again, we don't care. All right. You're sick. We're going to do the same thing no matter what. We're going to try to figure it out, but we really don't. We don't care what it is, right? We can't memorize every plant or poison. Okay. Again, aggressively manage the airway, take vital signs, contact poison control. If they have the plant right there with them, take it. So if they can figure out what it is and figure out the remedy for it. All right. If not, don't worry about it. Okay. These are the most common ones. Okay. I don't even know how to say that. Dieffenbachia. It's that weird, like faux plant kind of thing. Mistletoe is apparently a big thing. The castor beans I've heard of. Nightshade, you can grind the plant up and kill people with. All right. Foxglove and rhododendrons kind of do the same thing. There's edible flowers out there. People get them confused. All right. So Jimson weed. All right. Poison ivy and poison oak are the ones around here. We got to really worry about poison sumac, the 3 on the right-hand side of the screen right now. Okay. I was always taught if it's bright red, it's bad, right? Don't eat it. Okay. That's just a helpful hint for the rosary peas. Poke weed. I don't even know if we have poke weed around here. I haven't seen anything like this, but do we? Oh yeah. I mean, it kind of looks like blackberries. Elderberry. Yep. Yep. Is it absorption though? Like if you get it on your skin, will it do anything, or? I mean, yeah, if you roll around it, but if you're just walking down the trail and you go, oh, purple stuff, like you're pretty good. Okay. I think it's like the first class I've had like resident experts in just about everything. Huh? Right. Well, that's what I'm saying though, but it's nice to be able to ask like people who deal with it all the time versus having to figure out. All right. Any questions on what we went over tonight? otherwise we are done for tonight, and then we will catch up on Wednesday, because all we have to do is go over behavioral and gynecology, and gynecology is like 20 slides. So anybody have questions? Everybody's good? All right, we're all set. See, some of you guys don't go anywhere, Mark.